Welcome to LECOM Health Matters. Our guest today is Dr. James Lin, President of the Institute for Successful Aging. And Dr. Lin, welcome again to LECOM Health Matters.
Thank you for having me.
Oh, it's a privilege to have you, Jimmy. September is what is called Healthy Aging Month. And it started, from my understanding, about 15 odd some years ago. But clearly, the concept of seniors and healthy aging has changed. So let's begin with the basics. What's a senior? What age?
Well, I think chronological age is the line is getting blurred. Everybody's living older and older and stuff. So to me, the real question is the physiological age of an individual. So, nowadays in 2022, there are a lot of chronic diseases. So when we look at, care, we're looking at how complex one's chronic conditions are. So to me, really, if you turn your fourth and fifth decade of your life, we should start to begin to talk about prevention for chronic diseases. And then a lot of people, by the time they arrive at fifth decade of your life, they have more than 2 or 3 chronic diseases, such as hypertension, diabetes, or even obesity. And those are things that contribute to, cardiovascular disease, as well as cognitive dysfunction as the years goes on. So to answer your question, there's not a clear line in terms of when people become seniors, but the AARP and Medicare defines it, I guess, different age groups, even in those 2 categories. So I would say the traditional ways people think 65 and above would be considered a geriatric patient or seniors, but I would argue that the number is getting lowered because of the amount of chronic diseases that we're seeing in the population that's increasing.
So either way, I qualify.
Yes.
65 or 60, I qualify. Jimmy, I want to take you back to Cicero in 44 BC. Cicero wrote that old age is respectable as long as it asserts itself, maintains its rights, and is subservient to no one. Meaning old age is not, period, a phase of decline or loss, but a new opportunity at life. We've really looked at senior aging, thanks to you and your work, differently than we have ever before. Is that true?
Yeah. And, the goal, even way back then, people understand that.
Which I wasn't there at 44.
Right. But the concept really, what hasn't changed all these years is that people want to live the quality of life, right? So they don't want to suffer as they continue to age. So the goal is always to optimize their health and optimize their function, both mind, body, and spirit. Those 3 things have to be aligned and to function properly to have good quality of life. So we often say that it's not how long you live, is really the quality that you have while you are living. And those are important concepts. So if you follow that concept, then preventative medicine becomes very, very important, which I think in 2022, even healthcare professionals, as well as the general population, we're not really particularly paying attention to that as much. And there's a variety of different reasons, because right now, healthcare is really driven by pharmaceutical companies as well as insurance companies. And while the insurance company, they want to talk about prevention, but their real goal is to really save them money in the long run. And pharmaceutical company, their job is to push medications and to solve a disease-specific problem. And they're so focused on that we sort of tend to forget we should do the simple things and do prevention as a number one thing rather than intervention, right? If you can prevent things from happening, then we don't have to work as hard for prevention. For intervention.
But when it comes to healthy aging, we're clearly looking at a person's mind and their body and their spirit. Let's talk with their body. Clearly, there's numerous ways that as people age, they can take care of themselves. How can the Institute help them? The Institute that you run for successful aging. I mean, I'm at the point of life where there are things that I probably shouldn't be doing, but the general public, if they're in reasonably good health, focusing first on their body, what should they do and what can you offer so they can, in a sense, check themselves off to make sure they're progressing in the right way relative to healthy aging?
Yeah, and I think this simplest approach that we do that we can help in anybody is that we do what we call comprehensive geriatric exam. And it's not, I hate to use the word geriatric. It's really a comprehensive exam that gathers data, and that's what traditionally we call a history and physical. But we do it in a way at the institute where we really get into details of their every aspects, particularly paying attention to their function, then their social life, and then also and that gives us an understanding where they are in terms of their mental health, right? So those are physical and mental health are the two major things when we do a comprehensive history and physical that we really look at. And we pay particular attention to preventative things. So anyone who's over the age of 65, for example, if you're a woman, we screen for osteoporosis. That's something that we do on a frequent basis. We do cognitive screening. We do physical assessments to assess what their gait and their balance and so forth are, and what their risk for falling is. And we look at their nutritional status, right? And we try to understand what their lifestyle is all about. Then when we look at laboratory values and stuff, we tend to look into a little bit more detail about their hormonal health, as well as certain aspects of lab references, even though it's in the normal reference range. But if they have symptoms or signs that we see, we have to evaluate those reference range, because as you have to understand, the reference range for blood work is on a bell-shaped curve. So if the lower range and the upper range, it's sort of an arbitrary cutoff and stuff. So if you just happen to fall in within the normal range and you're having symptoms, it's not normal. So the best example would be, vitamin B12. When we look at it, it's known in the neurology world and in medicine that we want to keep the B12 level at 500 or above, as an example. But many clinicians, when they look at it, as long as they fall in the 250 to 1,000 range, they consider that normal. So if you get an individual that have peripheral neuropathy that has B12 level at 300 and their cognitive status is beginning to decline, well, that person is not optimized. And even though when you do the blood work, you might come back as quote unquote normal, you have to take the time to evaluate the patient and to really dig into to really interpret that as, is it normal, or is this something that we need to pay attention to? And that's what I mean by not only looking at the big things for prevention, but if you look at those laboratory values more carefully, you might be able to pick up things early. And that's the whole point of doing a comprehensive wellness exam or a geriatric exam.
How about age and exercise? We hear a lot about the importance of it as people age. And I think when people hear the word exercise, they think you should go out and run 3 miles. I don't think that's what you're talking about relative
No,
exercise for people.
no,
It's
we
good.
usually say that it's physical activity that can get your heart rate up, and you sustain the heart rate up for more than 15 to 20 minutes 3 times a week, and that's sort of the minimum. But the best type of exercise is actually just simply walking. And if you walk long distances, if I tell the patients all the time, simple thing is that you get a step counter, or even now with the wearable watches and cell phones, it measures how many steps you take a day. So on average, if you're able to do 10,000 steps a day, that would be an adequate physical activity for an individual who is a little bit older and stuff, right?
Mhm.
So that's those are the basic things. And oftentimes when we talk about diet and exercise, it's really understanding what their lifestyle is like, what their routine is like, and trying to come up with a way for them to incorporate those activities and the diet regimen, so that they don't have to really change, so that they don't feel like it's work. So you have to slowly change them and create habits for them, so that it becomes a habit and it doesn't seem like it's work. Many times we see, diets that don't work is because clinicians don't take the time to find out what the individual lifestyle, what they're like and dislike, and we sort of force it upon them. So there's a book that they follow, a formula they follow, but but it's not sustainable. That's why people fall off the wagon for diet, and then that's why people stop exercising, and then they oftentimes reinvigorate themselves with a new year resolution and things like that. So our approach is more, again, understanding what their lifestyle, their habits are, trying to incorporate the ideas so that we can integrate those ideas into their lifestyles. So the change are small incremental changes that's sustainable, and that we can slowly change their lifestyle rather than, a formula recipe that we force it upon them and it doesn't work.
Part of lifestyle is clearly seniors' mental health. I read somewhere in preparing for this that there was a study done in 2021 of 11,000 people 70 or older, and the study concluded that loneliness has a lot to do with heart disease. And so I don't know if it's valid or not, but the idea of seniors' mental health has to be a key to their successful aging and their successful living in their senior years, is it not?
Yes, yes. So the most common cause of depression and anxiety is isolation when you get older. So many elderly adults hold on to the idea that they have to live in their home for 50 years, 60 years. And the reality of it is that by the time they get to, seventh, eighth, ninth decade of their life, even though that's their home, they have changed and that home no longer accommodates their needs. And what ended up happening is that they ended up having social isolation where they can't get out of the house and their loved ones are far away, out of town, and so forth. So they become isolated. And those are individuals that are increasing risk of having depression, anxiety, cognitive decline, as well as falls, accidents, right? So um, in terms of it's a good, it's a um, important thing to understand that human beings are a social being. They need interaction with uh, humans, and even doing Zoom is not really considered human interactions. And we learned this from COVID because of the lockdown in our senior
True.
communities for apartments and assisted living and nursing homes. We see the amount of depression and anxiety just skyrocket during the time of COVID when we were locking down. They couldn't go out. They couldn't socialize with each other. They were essentially in their own room or their apartment, and there's a significant mental health impact. Therefore, that eventually lead to a physical decline that leads to signs and symptoms of other issues. So
Well, I saw that. I see that, in my role, clergy-wise, you see that in terms of the loneliness of people when they become isolated, that their physical health actually begins to deteriorate.
absolutely.
And so the Institute clearly is looking for them relative to provide social opportunities for them, especially since COVID hopefully seems to be easing, to get them out of their rooms if they can, but to get them, we are social creatures, and it's critically important for us to interact one with another to validate our own selves.
Yeah, and we knew that was really important even during the height of the pandemic. And we modify spaces in our community so that, at least the loved ones can come in and visit where there's human contact rather than just, via video and stuff. And now, COVID has sort of changed a little bit. All of our, as you know, we're the leaders in vaccinating
Yes.
COVID. We're one of the organizations and institutions for the state of Pennsylvania for long-term care that we deliver vaccinations. And we learn that now the virus sort of changed because the population is more vaccinated, they have immunity. When you do get COVID, they tend not to be as sick. So our paradigm has to change a little bit from this whole idea of lockdown, isolation. We're sort of trying to be more open and be aware of what's happening so that we can have more social interactions and not go back to, when during the height of the pandemic. And that's something lesson learned for all of us, that there's a price for everything. And at the end of the day, now we're sort of coming out of it. that I think that COVID is still very important. We still track it, we still test it, but we understand that there's alternatives to provide socialization for these people that are institutionalized, and also for people that are living at home themselves. So it really becomes an important thing. So as far as sort of prevention, down the line, in the future, um, we sort of have to reevaluate how we, do our policies. And if there's another pandemic that happens, we've learned enough that, I think the building design, the way we sort of workflow wise, we can minimize the contact, but yet provide the socialization is really going to be the key for
Well,
the
even the
future.
windows in the building, and I see
Sure.
the light, the light, the outside. So clearly the Institute is taking a comprehensive approach to healthy aging by looking at people's bodies, obviously, their minds and their spirits, which is really a different paradigm relative to how people age. We just don't warehouse them and wait for them to die.
Yeah, that's exactly right. And the other paradigm that we have to start changing is that, medicine traditionally has been studied, in if you go back to the history of medicine, it's really a disease specific with one intervention. So it's like a one and done type of thing, and we
And
still
then,
carry that concept all the way through. Except, if you step back, the osteopathic approach is obviously, ahead of its time, right? Because what Dr. Andrew Steele is really saying is that our body have the inherent ability to heal as long as we put them in a state where we balance them in a homeostatic state, and then we can heal, and then we can prevent disease. And that's really the concept and the core of how we approach geriatric patients and stuff. Because um, uh, the idea that I'll just give you an example. 1 in 4 people in the United States have cognitive impairment, and dementia is a rampant disease. And up to now, the last 50 years, we haven't been able to figure out one medication to cure or treat dementia. And why is that? Well, the reason for that is because the etiology of dementia, the pathophysiology for dementia, is a multifactorial pathway. It's not a one and done type of um, uh, disease. And our brain is the most complex um, matter in the universe. It's got billions and billions of cells. It does millions and billions of functions in a second. And for us to think that one medication is going to solve and cure dementia, it just doesn't make any sense. That's why we haven't been able to make any strides in dementia, the disease of dementia. So the paradigm has to shift a little bit. We have to be more comprehensive and more holistic in thinking about this. And just the pathophysiology of dementia to prevent the amyloid plaquing, well, there's 35 reasons why we produce the amyloid plaque. And to get a medicine just to attacking the plaque may work temporarily, but we haven't stopped. It's almost like there's 35 holes in the roof and you're only patching one hole,
You
and
gotta
then the
patch all
other
30,
34
you gotta
holes are
patch all
filled.
35.
So you're not going to make any headways. And that's how we're approaching the disease in dementia. And it's really important for us to look at it holistically. So our approach, for example, at the Institute for Memory Assessment, for example, we do the gold standard, what all the centers do at the big university centers. We do the imaging, we do the laboratory valves, but we take a step further. We really study the hormonal imbalance as an individual gets to their sixth, seventh decade of their life. We look at their food and their diet and their gut biomes, and then we also look at whether or not they've been exposed to heavy metal toxins or any biotoxins such as chronic inflammation, such as have they ever had Lyme disease or these festering disease, even periodontal disease. And we have a dental school, and our colleagues at the dental school know when they take care of geriatric patients, when they have periodontal disease, they got chronic inflammation, and those individuals are high risk for having dementia because the inflammation can cause the continual plaque formation. So if you can have a medicine to get rid of the plaque, but you don't stop the periodontal disease, well, you're not going to be able to solve the problem for dementia, right?
Just two quick questions, Dr. Lynn, as we're beginning to run out of time. Clearly, it's correct, I think, to say that Healthy Aging Month that we're celebrating in September, that's precisely what the Institute does. It's a comprehensive approach to aging. So aging is not rapidly going to an endpoint, but an opportunity to develop a different phase in life as you're a senior. And I think that's correct.
Absolutely.
Let me ask you a difficult question, and I'm not exactly sure how to frame it, but I'll try my best. As people see our facilities and they're concerned about their loved ones, they're also concerned about cost. What do? Do they call? Are there people available to counsel them, to walk them through, which is clearly a very challenging and difficult process for all families of all income levels? And I think people don't even know, like, where do I begin?
So we have expertise in different level of services within our continuum. And the whole idea of the Institute for Successful Aging from the beginning, since 2008, when we didn't have any services, the vision was to create an integrated continuum of care for geriatrics. So we want to be a one-stop shop for anybody that needs care, and we will meet them at the level of care that they are currently at. So we can meet them at the outpatient preventative clinic at our Institute of Successful Aging at the Wellness Center, or we can meet them at, VNA Home Health Hospice at end of life. But the whole spectrum is there. So depending on where you are in your journey and where you are in terms of your health and what your needs are, we have people on our team that we can sort of insert you into the service that you need right now at this time and give you a comprehensive idea of where we need to go and how we map out the roadmap for you in the future. And the whole goal of this is to optimize your function so you're staying at the highest level of functioning service line that we can possibly keep you. So we do have a team of people that can guide you through financial things or level of care that mom or dad needs, and what even patient themselves would have questions about. We can tell them where they are in terms of their health and try to get them to optimize levels so that they can function at the highest
People
level.
should be encouraged to call. I don't know how many people I have told, if you have a loved one that you're concerned about, that you think it's getting too difficult for you to care for at home, or by caring for that person at home, you might be doing them harm. There are teams at the Institute that will walk through the whole spectrum of activities and possibilities
Absolutely.
and finances with you. And you
So-
shouldn't be afraid to call.
Exactly. And we're on Facebook, and Instagram is LECOM is Aging. LECOM IS stands for Institute of Successful Aging. So it's LECOM is Aging. If you follow us at LECOM is Aging, you can direct message us on Facebook, on social media. Somebody's always monitoring that if you have any questions. We post different things on Facebook. We have a website, lecomisaging.com. They can go on that website and they could just hit contact us and email us, and somebody will get back to them. And whatever your needs and questions are, those are two very good ways for you to contact us. And we monitor those things almost 24 hours a day. So somebody will get back to you within 24 hours if you have any questions about care issues or any questions about our services.
Well, Dr. Lynn, we're out of time. Number one, healthy aging is important, and let me thank you for what you are doing to help this community in Northwestern Pennsylvania healthy age. It's a very different way of looking at aging, and I think it's a very healthy way of looking at aging, that aging is an opportunity for different things, and you and the Institute and your team are providing those opportunities. So thank you for what you're doing for older people. I won't say like myself, so don't you, but thanks for all you're doing for us. Take care, Dr. Lynn. Have a good day.
Thank you. Thanks.